Well, hello everybody, and welcome to another episode of the Informed Chiropractor Podcast. This is Dr. Don MacDonald, your host. It's so good to see you. How are you doing
Hi,
today?
Don. Yeah,
Yes.
really good. Thanks, Don. It's lovely. We haven't spoken for a while, but this is such a treat.
Yes, and for anyone else who's just listening today, we did have Dr. Donald Francis on the podcast here probably I think it was before COVID, so it's back in the archives, but
About number
um
56, I think.
oh, yeah, you got 56. Okay, he's got the number somewhere
No,
around
it's
there.
about that. I do remember when I did it. It might
Somewhere
be
around there. Yeah, we're at
66.
170 or something now, so it's back
Yeah.
in the archives. But just for those who are listening, Dr. Donald Francis went to Palmer College and then went back over to Scotland and has been doing some amazing stuff over here. And I really wanted to get on the podcast because we have kind of like a little bit of a similar path that we've been doing where, the first 10 years of practice, we learn a lot of different techniques and get a lot of experience. Um, we both had experiences working with ALS with practice. My really good friend Rob had passed away from ALS, and then after that, you had Dottie um,
Yeah.
under care too, and so we had some similarities with that. And then we had some similarities where we've both been getting into teaching some technique and helping chiropractors just kind of up the skill, sharpen the saw a little bit. And so I wanted to get Donald on here to talk a little bit about that process and getting into teaching the technique. First of all, how's things going in Scotland? How's things going post COVID?
Well, in some ways, COVID was a bit of a gift. There was a lot of problems with it, but our GP system wasn't seeing anybody for ages, and the only people that you could get into was the chiropractor. So we bounced out of COVID really well, actually. And
Yeah,
the wonderful thing about the COVID epidemic, there was a lot of things which weren't wonderful, I'll give that. But we sort of had time and we came out as a completely recalibrated business in so many different ways. And, it'd be interesting to look back in 25 years' time because it was definitely a sea change moment in my personal business and life. There's the before COVID team, the before COVID systems, the before COVID everything, and then there was the after COVID. And
totally.
we're much better, much more streamlined because we had that little check when we were able to pause and readjust. But Scotland's going good. Question, you were probably also leaning into the new Scotland College, which has just taken its second cohort of students.
That's so cool.
Yeah, I don't have much to do directly with that, although I did produce a book, which you and Brandy were kind enough to submit a chapter for. We raised 60,000 Canadian dollars with that, so that was pretty
That's
cool.
great.
And they still got some political hurdles to get over before the accreditation, but I think every new school has those things. But all the word on the street is that I think there's about 30 students there at the moment in 2 different years, and I think morale is good. And they've taken on some really high caliber staff. One of Heidi Horvick's colleagues is over there now teaching
Awesome.
and looking at setting up research. And Bettina Torantora from Australia has
Yeah.
come on the staff. So, they've really upped their size of the cannonballs they're throwing now. They're doing well.
Yeah, it's funny because we were just last weekend at Life University's 50th anniversary and hearing the stories when they lost their accreditation and the student the enrollment went way down. And Dr. Guy Rickman was talking about they were like at the final hour, they had to raise a certain amount of money before the accrediting agency would even like look at them to get them accredited. And it was like at like close to midnight. Like they just made it that close. They was just barely right on the money. And so like I think in chiropractic, it always seems to be like in our brand, like all the schools just get annihilated, and then at the last minute they just make it through. But
I think it'll do it because they've got, there's a lot of weight behind it, but it is hard in a jurisdiction like ours in the UK to get a school which in all of the preamble used the word vitalism, whatever that means. I didn't when I was at Palmer, I never even heard the word vitalism, whatever, but if you use that word, as we were talking about in our preamble before this, there's so much judgment in chiropractic and people easily put everything in the fact they're teaching state-of-the-art neurology, anatomy, they're actually going to do dissection, which none of the other UK colleges do.
oh, cool.
So they're going to do some really state-of-the-art cutting edge stuff. Wherever the mud sticks, it's stuck in some places. So.
Well, I know it just seems like that all the time. So I'm glad that they're doing good. That's the main thing because we kind of got to grow that. It's funny because in the old days, you talk about judgment. In the old days, they talked about mixers and straights, right? And mixers would
Yeah.
be anyone who just below Atlas, and straight
Yeah.
would be Atlas. adjust. And so I
Yeah.
think there's a new definition now. So that it's like a chiropractor, or what is a chiropractor that doesn't even adjust now? Because now there's ones that don't even adjust. So like we've gone away
Particularly
from
in,
mixing into the
yeah.
lower spine into like not even adjusting.
Yeah. I think in south of you in the United States, I think there's a lot of chiropractors doing inject Botox and things. You know, you can do.
I think one of the challenges, and we've seen this a lot with some of the students, is that just some of the schools are not really emphasizing the chiropractic adjustment very much. And so the challenge is we have an intern in our office too, and he went to chiropractic school, never being to a chiropractor before. Just thought it would be cool to be a chiropractor, and then his first adjustment is by a student, and so I just always say it's amazing going like so much debt, and then you don't even know what the product feels like. And no wonder you don't want to, because you've never experienced an adjustment that's kind of done by someone who's very good at it. And then you haven't had enough practice to get really good at it as well. And so I think that's why I think we're starting to see too, like a resurgence of some different technique seminars to get people kind of honing up on those skills, because it's pretty rare breed to have like good adjusting chiropractors nowadays.
You're right. And I think well, certainly I've found in the UK and Europe that there are some good, I mean, if you want to learn a very good straight diversified protocol, and there's a pair of guys called Syntropy, and
Yeah.
they do a pretty good, and they've made a big storm around the world. And I think, you know, if you're a new graduate and you did your numbers doing squats and massage and other things, and you want to learn how to adjust, then that's probably your first port of call. And then once you've started moving, once you can move the bone and change your headspace a little bit, I have to say you and Brandy are a bit of a gift to the chiropractic profession.
Just so you know, I
I
paid him to
find
say
myself
that.
I find myself 7 years on from when I first started in the vitality shift, and I still utilize language that I've picked up along my journey with you, and we still use the vitality shift every single day. We still put all of our new associates through the entire program and the CAs.
It's
So
awesome.
you guys have done, but when those segued out of that model and they're looking for a more intelligent approach, then I think they've already got some foundation to build on. Then I think your informed chiropractor, your polyvagal route that you guys have taken over this last couple of years is really extraordinary, actually.
I just find it like it just they was I think was it I think it was from the ICPA, and Joel Alcantara had done a research study saying that one of the most important things for patients to get the results under care is to actually having them be able to make sense of what's going on, or make sense of what's going on with their body. And like the polyvagal language, out of anything I've seen, is the most, and it congruent with every single thing. So I'll call it chiropractic principles, all the stuff we're talking about with prefrontal cortex. We were just at the seminar this weekend, and everybody's talking about all the different things, and it just can link. What I love is I love common principles. It can just link into everything. It's very
Hmm.
it matches it all. It just has different language, but yet we
Hmm.
can simplify it really down to something that's very easy for a practice member to understand, and they go, "I got it." Like there's not one person who, when we explain it, talking about safety in the nervous system or in a protective state, or perceiving danger when there's no danger there. Like nobody doesn't know what that means. So that's like
Hmm.
it's like basic. Well, yeah, but then it makes sense to them. And then the cool
Hmm.
thing is, if a chiropractor, if it can make sense to you, then we can actually start to become creative, because like what's really helped me is that if you just understand the principles of physiology and neurology, and just understanding what our body's physiological responses are to the stressors and how we're interpreting our environment, and we want to help to recreate that state of ease or state of
Hmm.
safety in the nervous system, and we know what that looks like, then we can start to be creative with our technique, because then we can use all the
Absolutely.
schools, all the different all the different techniques we've learned in the past, and then we can kind of blend them and become artists ourselves. And that's why I wanted to get you on the podcast too, because I really actually one of the things is that because I've been starting to do a lot more cranial work, and I never did that much cranial work.
Hmm.
And I think the very first time I even talked about, like, I've heard about the sphenoid and stuff, but we were in that bar in London. Do you remember that?
Hmm.
And you pulled your bag out with a rubber glove in the
With
bar.
a rubber glove, yeah.
And you're like,
Adjusted brandy in the bar, yeah.
and you're like, okay, there's this sphenoid. It always seems to be the left side, which is hilarious because all different around the world. Yeah, it does seem to be most commonly the left side.
So
But
so
but I was
there's
just
an
gonna
interesting
say
thing
that
there's a segue we can take on the sphenoid, which will just help people understand a few things, actually, if you want in a second.
Yeah, and like I said, that is just kind of really tied into our whole safety corridor too, just as far as the Dura. And
Mhm.
so that's why I just wanted to kind of get back and throw it to you and tell us a little bit about kind of like your history with SOT and then how you've kind of evolved the way you explain it.
Okay, so just a very quick I grew up in the SOT community in the UK. I did it at Palmer because my mentor, who sent me to Palmer and gave me my first adjustment in 1977, was Mr. SOT here, and then he moved on. Well, he then evolved a new cranial technique called craniofacial dynamics, which is brilliant actually, and I use it every day, craniofacial dynamics. And that's centered very much around the sphenoid. I've taken my understanding a little bit left field slightly from that. And the way I see the body is definitely like all of our experiences, it's the amalgam of absolutely everything that I've learnt and processed. But just to look at the sphenoid very quickly as a bone, it is a really important bone, I think, for driving the whole pattern that we have. The superior sagittal sinus, which goes down just underneath the top of our head, drains into the right sigmoid. The inferior sagittal sinus, which is much smaller and has less pressure, drains into the left. And this creates a permanent in utero forever a deviation on the sphenoid where the right side is always forward and the left side is always backwards. And I observed this for the first time. I was studying for my cranial exam, and I got off this study call, and I opened up. Do you remember Mr. Llewellyn at Palmer? He used to teach neuroanatomy, first
Yes, I
class,
do.
7:30,
Yes, I
first
do.
trimester. So I was reading my neuroanatomy book, and it said the superior sagittal sinus drains into the right sigmoid. It is always larger and under higher pressure than the left. And it suddenly dawned on me why we continuously found this pattern.
Mm,
Um, and this pattern that drives a torsion within the meninges, which then perpetuates throughout the body. And I mean, we can all argue and disagree over this. It in a large to a large extent is the cause of the short leg when you are prone or supine.
mm,
And the way I see the world in the way I look at it is very durally driven. Um, but I also see it very similar to how I've heard you and Brandy explain it in the Polyvagal seminar I did of yours and also through the multiple podcasts, is when we were at school, we were all told, we all understood the nervous system as a motor effect. That when you go into your fight or flight, your eyes are going to dilate, your heart rate's going to increase, the sympathetic's going to stop your viscera, your glands are going to dry up. And then when you come back into rest, repair, and digest, your eyes will constrict and your heart rate will slow and your viscera will go. And that's the motor effect. But the whole autonomic nervous system, be it the parasympathetic or the sympathetic, is mostly sensory. And all of those sensory nerves, which go up the parasympathetic nervous system, either go straight, mostly in through the jugular foramen, which is just right next to Atlas, between Atlas and occiput, really. And it also goes in through your sacrum, the three sacral nerves. So that 80% of that sensory awareness of our body that is not our somatic body goes in through our autonomic. Into our sympathetic nervous system, the 80% goes in through your IVF into through the ganglion back into the cord. And it does that at every level, not just T1 to L2. It's because there's a sympathetic chain ganglion at every level. So the way I see how that causes adaptation is when the vagus say, let's just pick on red wine because I like red wine, but it doesn't like me.
mm,
But if I were to drink a lot of red wine, one of the organs that would be heavily involved in its processing would be my liver, and that would actually cause a a bit of a bit of an adaptive response on the right hand side, and that would signal an adaptive change up the right hand side vagus. This causes a constrictive response in the dura through the right jugular foramen. And this constrictive response in the dura changes the whole dura and causes that sphenoid, which is forwards on the right and backwards on the left, to effectively lock. Because that twist is actually innate perfection. We require this twist to allow the spiral to go throughout our connective tissue to allow things like cerebrospinal fluid to go all the way down to to our coccyx and all the way back up. And we rely on that spiral throughout our body all the time. Our aorta is in a spiral, our vena cava is in a spiral. That all of that is within the spiral. And that spiral is normal until it becomes maladaptive. And when it becomes maladaptive, the brain can't find its way out to cause the adaptation back. And that's where the chiropractor comes in. They put an adjustment in, which changes how the brain understands the somatic body, be it cranially or spinally. Nobody's wrong or right, and everybody sees chiropractic through their own lens. Everybody sees that the subluxation determined through their own lens, and the correction of that. Try and argue full spine to somebody who sees the subluxation through an Atlas axis comp, and you're gonna be talking Chinese and English,
Right.
and so on and so forth. But effectively, how I see the subluxation occurring is that it's every subluxation in the body starts as a perfect adaptation to stress, a perfect adaptation. It's only when that subluxation becomes perpetuated through the having to constantly adapt that it becomes a problem. And that adaptation can be birth trauma. It can be childhood trauma. It can be toxins such as alcohol or tobacco or preservatives, and it can be postural. And last time I saw you guys, I think it was 2022, and I'd had a terrible year mentally and emotionally. I was in a real funk actually. I'm much better now. And I don't know why. I still don't know why, but we came through it, and I had never realized that I thought I was completely immune to COVID. I was, well, not to I had COVID. It wasn't very nice, but
You mean the mind virus part?
I certainly, this, if people want to go back to my backstory on the first episode I was interviewed, my father was killed when I was a child. I fought in Iraq. I've done a few things, and all of that past seemed to somehow regurgitate in my mind. And no matter how often I got adjusted, it was hard. It was hard to break that pattern. In the end, it took a lot of work and not only getting adjusted. I should look a lot thinner than you last saw me. I've lost like 16 kilos since then.
All right.
But a lot of it was doing similar things to what you guys are doing. I've given up sugar. I intermittently fast every day, and I exercise like a banshee. But anyway,
good job.
That was all part of that change. Getting out of that, breaking that cycle, that perpetual stress cycle.
Yeah.
But anyway, that's where it's that sensory autonomic that I think is really key to how the entire nervous system changes. And how we change that, is whatever technique you use. But it's that sensory awareness of our nervous system using those autonomic sensory nerves that I think is the largest single contributor to brain adaptation.
Yeah, well, and that's so cool because if we learn about that, the 5 cranial nerves from the social engagement system, and it has the face-gut connection. And then you start to open up some cranials and start to take some tension off the fascia in the skull, which helps to kind of get you a little bit more socially engaged, as well as adjusting, segmentally, globally. It just helps to kind of you can just see the regulation. And if you're looking for it, you can see it. And then that's the positive feedback to the chiropractor as well. I was thinking possibly in the past, because you'd had so much trauma in the past, if we always think of a bucket, and then maybe that was like part way up the bucket, but you're adaptable enough in the upper part of the bucket that just COVID just kind of popped that top one and made you just kind of like fill it up more, so that it kind of got you focusing on changing some stuff.
I think it was a very stressful period for everybody. I mean, we didn't close. I stayed open, and I don't know who's going to listen to this, but I didn't wear a blooming mask, and I just carried on, But I was quite surprised by it when it came, because I genuinely think I live absolutely in the present. I remember going to the last seminar you did around Heathrow. I think it was, the last one I went to was about 2 years ago, and I could see with your MacDonald safety corridor that you were achieving changes that I could observe I think it was Dara Tyrrell's baby. You changed the shape of his face without actually doing any cranial, and that was a real eye opener to me. That there's so many different ways to metaphorically skin the cat. That
Yeah.
we're and I could watch his eyes change, and he and he and you did that without doing cranial, and I was like, okay. And my opinion, for what it's worth, is
Hmm.
by taking the stress response off that 80% of the vagus, which is sensory,
Yeah.
that changed the how that nerve was interacting with the central nervous system.
100%. Well, and that's the cool thing about the polyvagal theories, because all the nuclei for all those five cranial nerves that are in the social engagement system are like so close located in the brainstem
Mhm.
that when you put a positive like sense cues of safety into that, it blends through them all. Just like the opposite happens if you put cues of danger through one, it blends through
Mhm.
them all. So if you can, like, by working on the viscera, calming down, putting cues of safety through the vagus nerve, it can calm the tone down in like the facial and the trigeminal and all that stuff too,
Absolutely.
which just helps with the tone of the tissue. Again, if you're going to do cranials though, because like even then, I'm actually doing more cranial stuff now, even than I was doing then. And then it just even
Mhm.
becomes more amplified because now you're getting it from the vagus, from the viscera, from the cranium. And like it just feels like you can get that regulated state a lot faster. So, and like we were talking before the call, I was saying the more we teach it, the better we get at it, and the more we're able to refine it so that we can kind of get more efficient with
Mhm.
our technique.
I think I love that you went on to viscera there, because some of the spinal purists will do their nut over this. But actually, I think visceral chiropractic, I might be a craniopath, but I think visceral chiropractic is probably one of my sort of chiropractic superpowers, and how quickly I'm actually able now, with my long experience in it, to zone in on which system's actually the crocodile closest the canoe, which one is the one that we need to, and much like your safety corridor, I've got mechanisms to neutralize that autonomic system response.
Mhm.
And I'm not saying that I hate when somebody says you stimulate vagus. I'm not quite sure how you stimulate vagus. Do you rub the vagus somewhere? I only adjust,
That's
but
a great analogy because I always say the Vegas is like it's like a security system in a building. So it's a
yeah.
security system that's surveilling the tissue that what you can't stimulate the security system. Like, yeah, it just there's an input in and it will determine if it's safety cues or danger cues.
There's definitely, in my opinion, and I use that word in my opinion all the time, because I'm certain I'm right from my experience, but I'm certain you're right as well. And we both get really good results and have people traveling a long way, and lots of things to shout about. But it's just chiropractic.
Yeah.
That the jugular foramen, which is right at the back here, which has three really important cranial nerves, and 9, 10, and 11. So
Hmm.
that's your glossopharyngeal, which is your speech, swallowing, your spinal accessory, which is your
Head
head, and
turning.
and your vagus, and I think the glossopharyngeal and the spinal accessory are very much uh, reported, very much talked about within those five cranial nerves responsible for how we engage within our social system.
Hmm.
But the actual foramen, the actual hole itself, doesn't change size, doesn't change space, but the tension on the meninges on the inside of it does. And I think that tension on the meninges does actually play a part in the effect of that nerve. And I don't want to go on a foot in a hose, but that tension definitely has at least an effect on that nerve, amongst other things. We could chase that rabbit all day, really,
Hmm.
but I think the jugular foramen is really important. I know trigeminal comes in through different ways. The trigeminal's got so many circuitous routes through the cranium, but they're all part of that. What did you call it? Sorry, forgive me. They're all part of
Just
our social engagement
social
system.
engagement system. Yeah, yeah. Well, and I
But
think,
but I think
oh, sorry.
visceral nutri let's not get snagged up in language, but certainly adjusting the anterior of the body, and probably like you, I can do it so quickly now that
Totally.
it's probably only added 30 to 40 seconds to an adjustment. And I'm reminded, the first time I ever spoke to you on the podcast, I thought I was doing all right in life. And every year I've been in practice, I look back and go, how the hell did anybody get better back then? But it's it, it's that quadrant. I think somebody on one of your podcasts talk about it, where you go from being an unconscious incompetent to a conscious incompetent to a conscious competent to an unconscious competent. And
Yeah.
I think the longer you're in practice, the more you move your whole life into that fourth quadrant where you no longer really even think. You only sometimes you sit and appreciate, and the adjustment moves so seamlessly. But it takes a long time to get that, and I don't think anybody should try and cut the corners. That everyone's got to pay the dues to get there.
Yeah, and it's funny because like what I found, and this is probably what's happened with you too, is that early in practice you can get to that unconscious competence. However, if we stay there, we start to get stagnant because, like you said, we don't have to think, like
Exactly.
we become automatic. So if you have to teach someone else, you have to drop back down to your conscious competence because you're like, what the heck am I doing? And then when you become conscious about it, you actually improve it. And then,
Well, and I agree with you, and I love the way that in the 7 or 8 year relationship that I've known you and Brandy, you've evolved from breaking the underdog curse to the vitality shift to the informed chiropractor. And the last 2 or 3 years, when you've been looking at the world through this polyvagal lens, it certainly, I remember the first time I watched you, the first time I listened to the interview with Dr. Porges.
yes,
That
or
right?
just
Yeah, yeah. No, it's quite a long interview, but I've listened to it 3, 4, 5 times maybe. That's why your numbers are so high.
it's all from this little place in farmland in Scotland, like that has all my podcast views. No, just kidding.
It was really interesting. It's even interesting watching your evolution over the years, and I agree with you. You can't stand still. I would be really, really sad if I ever thought I'd arrived.
Totally.
Really sad indeed. I remember when I was at Palmer, I was a student. I was talking to a doc, and he turned up to homecoming every year to get his CPD, but he never went to any of the lectures. He only went to get the sticker. And this guy had been doing the same stuff for 25 years, and he was making a lot of money, and he was really happy about it. But I was just really sad for him that he wasn't evolving his life. It was just same, same, same. But anyway, that's
Yeah.
my judgment on him. Not I apologize for him.
Yeah, no, it's hard, but so for you, tell us a little bit about when you started doing your spin on it, because we always talk about the best thing about doing the reps with a different technique, like say you do diversified or Thompson or activator, you do your reps and then you start to kind of put your own spin into it. And so tell us a little bit about
Sure.
how you started doing your brain-based adjusting.
If I were to say one day it dawned on me once I'd got that understanding that the sphenoid was right and back. And I was thinking, oh, well, I'm adjusting. Let's just pick on C5, good old C5. We like C5.
Mm,
And I thought, well, why was C5 subluxated? And actually, was the subluxation at C5, or was the subluxation a result of the brain's inability to change C5? Why was it stuck? Because the brain can move anything, but that joint wasn't moving, and as a result of that, it everything associated with C5 in it was affected. You could do neurological tests and the whole thing, you could chase the whole thing. So I came up with this idea, and it just shows you how lack of imagination I have. If anybody could give me a better name than brain-based chiropractic for what I teach, I'll give them a free seminar. In fact, I'll give them a year of free seminars. But um, really, there isn't anything that we do that isn't as a result of how the brain has understood an adaptation and its inability to change that adaptation. And I thought to myself, well, the subluxation is palpably at C5. We'll just stay there for now. But actually, the real problem is in the brain because it's no longer receiving the right proprioceptive feedback from that space, and it's therefore no longer able to engage with that segment, and therefore all the neurology associated with that. So that was my first sort of thinking, right? Okay, so really the subluxation, or certainly the effect is to the subluxation is in the brain. Quite a long time ago, actually, but it took me a long time to build up this idea. I came up with an idea that when we were born, as our innate brain, using that chiropractic word, was created, our brain must have had a map of where our body is within time and space. It has an inborn map of where our little fingers and our little toes and our eyes and our mouth, and so we can swallow and breathe. And that map should be all we need. But as we go through life and we adapt to multiple stressors over time, be they chemical, emotional, signal, causes the map and the reality to change. And if you stand anybody up in front of a mirror as they come in for their first consultation, you'll probably notice that more often than not, the left shoulder's higher, the right shoulder's lower, and the body will be in a compensatory pattern. And so what that sent me down the line was thinking, well, if the body's in a compensatory pattern, maybe the maybe the map that the brain has and the reality have evolved. So we now have the body and the map having changed. But actually, you're still alive and you're still functioning, but you're just not functioning as well. And so I then came up with this idea that the brain, in its infinite wisdom, will actually come up with its best guess as to where the map and the reality is. It'll come up with, in effect, a hologram of where it is. So then I started doing adjusting thinking in the SOT lens, which is what I grew up in. I no longer teach I taught SOT for 7 years, but I've moved away from that. Not hopefully, maybe not forever, but certainly for now. And I was thinking about that in terms of dura and fascia. And there is an absolute interrelation between the meninges, or particularly the dural part of the meninges, although the three layers of the meninges are so tight you cannot
tight
really
together. Yeah.
and fascia. So all you had to do actually to reset the map and the reality was take the stress out of the dura, and you could do that anyway. So my brain-based approach looks at the subluxation pattern in effectively two ways. One is a gross subluxation, which involves the entire distortion of man, woman, and that's what gives us that high shoulder and a high skull, or that twisted pelvis and the short leg, and remapping the body and the brain together. And that's a gross sublux. That's the gross distortion. And then the segmental distortion. My opinion, for what it's worth, is that the gross distortion is largely vagal, or it's largely parasympathetic, in that it causes changes at the top and the bottom. The segmental subluxation, be it C5, T8, T7, that tends to happen as a result of the sensory feedback from the sympathetic nervous system to that segmental level. Why would T3 just lock? What would cause a joint that I cannot move? I cannot say, let's move T3. Why would the myofascial system at that segment cause it to lock? And at the time that it does that, give it allodynia, which is the pain that you feel through palpation at that joint. And when I put an adjustment in there, what am I actually doing? Am I removing nervous interference? Well, yes, I am, because as that joint now functions, the brain is now absolutely aware of how to use that joint and the neurology associated through that. So my brain-based approach really just looks at changing the body on two major levels. One is the gross, changing the gross distortion, and the mechanism that I teach for that is pelvic adjusting and upper cervical or cranial adjusting, because if followed a very, very simple pattern, you can neutralize that gross distortion very, very quickly. And then the sympathetic adaptations, in my opinion, are the ones that are in the spine. Now, everybody has seen the construction. Everybody sees the construction of the subluxation through the lens that's got them to that's the way I see it. And I'm really happy. I achieved some pretty stunning results. I went to India last October. Actually, it was my 50th birthday. It was the 30th of October last year.
Cool.
And so I'm born the same year as Brandy, so you'll clearly know a good vintage when you see one done. And I adjusted about 700 people in 3 days. And I used my basic ideas to achieve some really stunning results. And luckily, my interpreter had his phone on him all the time, and we got loads of videos of befores and after from people with cerebellar ataxia, a guy who was totally paralyzed down the right side of his body, within 3 adjustments, he was walking, able to raise his right hand above his head. It was pretty stunning, actually. And that was just based on this idea of remapping the body and the brain back together again. And it takes me 12 hours to get the first module out the way, but that is in essence what I think is going on. But the more I listen to you guys talking about polyvagal, the more sense it makes to me actually as to why that major pattern distortion happens, and what we can do about changing it. And through what you guys are talking about, it gives us some language we can use to help people understand it as well.
Yeah, and that's why we always like to have our socials at our events, because like chatting like this is where you get all that knowledge. Because when you sit down with other chiropractors and talk about kind of the like not necessarily the technique, but your philosophy behind it, or your what is your goal? Like what is your end? What's the end game? I was just talking to someone this weekend who very straight chiropractor with adjusting the spine, and I said, well, just realizing that the vagus nerve is 75% of the parasympathetic nervous system. And
Yeah.
we're saying that we're like in the old days, we're trying to get people parasympathetic, that we're sympathetic. So if our goal is to get us more people into that sympathetic state, and 75% of the parasympathetic nervous system is the vagus and it's a cranial nerve, don't you think it would be kind of good just to like check it?
Yeah.
Because it's like
Yeah.
it's a huge portion of the parasympathetic nervous system when we're trying to say we're trying to get everyone parasympathetic. And they're like, oh, I never thought of it that way. And I'm like, and it doesn't like replace chiropractic technique, but like you said, if you know what to look for, addressing tone in either the dura or in the fascia is actually quite quick. Especially when
Mhm.
we do an adjustment, like as I call them amplifiers, because like you said, it
Mhm.
takes like 20 or 30 seconds. It just amplifies what you did.
Absolutely.
And if you even
Actually,
think,
I would say in the visceral adjusting, and certainly one of the rabbit holes I've gone down in that direction is one of my avatars. So I'm going right back to the vitality shift on.
yeah,
I've got
yeah,
my
here it
avatars, and
comes.
that's where I got them from, and I'll give you and Brandy credit for that. One of my avatars is not going to be everybody's avatar, and that is menopausal women from 48 to 55. Why I'm in that age group,
Yeah.
maybe, but the results we get are absolutely staggering. You're talking about being able to really stop hot flushes for 3 to 4 weeks. I have women who time their adjustments so that, one woman, we managed to get her after years of adjusting, but she's been a patient for years, but she's in the menopause now, and a single adjustment can almost turn the hot flushes off for 3 weeks. So she was, by her choice, not mine, coming in every 4 weeks. And I said to her, hey, listen, you're having 3 weeks of no flushes and 1 week of flushes because you want to stay on this 4 week cycle. Why don't we just move your adjustments to every 3 weeks? She said, can I?
How how
I
would
said,
how would
of
you
course you can. It's your money, your
how
time.
would you
You
like to
do
have 12 more weeks of enjoyment of the year?
Yeah, why not? And but the visceral, so anybody who's done any visceral adjusting, and the neurological entry point for the ovary neurological system, so even people who've had hysterectomies, is over the ovary space on the anterior abdomen, and you can neutralize that. And I don't mean you're just neutralizing the neural system. And I don't want to go too much into whether it's sympathetic, parasympathetic, whatever. You're just neutralizing the segment. And that has a direct correlation back to the spine, because when you take it out the front, it's no longer sending an SOS back to the spine, which is going to relax the spine and the dura. So yeah, I if I was stuck on a desert island and they said I had 3 adjustments that I was allowed to do, one would certainly be at the top, one would certainly be at the top, and the other one would be visceral. I'm sorry, I know the purists would probably hate me to say that. And I actually think from my lens, I'm a really straight chiropractor. I don't do any rehab and I don't do a lot of nutrition, and
Yeah.
I certainly will give people advice on how to stop subluxating themselves.
Yeah.
And I've got a lot of it from similar, shown direction through you guys, through Don Clum's insulin fasting and stuff,
Yeah. Yeah.
and stuff, people who've been on this podcast.
Yeah, no, and I think it's funny because like I'm the same. Like you kind of learn, just I think just to learn to be more efficient. Like I think like now I just am more efficient with having more of those tools in the toolbox. I think a lot of people think that if I learn more new things, is it going to slow me down in practice? And it actually kind of it makes me more amplified because then you can drop away some
Mm.
other things. Because there's some things that you're doing that might have been doing before that you don't even need to do anymore if you clear this stuff out first.
Isn't that true? And I hope people carry on learning new things. I think learning new things is so exciting. But I do. We were talking before about, I was listening to your podcast. You did a solo podcast recently talking about your six corridors, your six safety corridors. I think it's genius actually. But there was something you said on that made me change the course of my whole adjusting seminar this weekend. And that was, people go to a technique seminar that's just too much to take in. That actually the next day they go on Monday and it's just too big. And
Yeah.
so because of what you said on that podcast, I then started my whole preamble and a whole different tone of how I took the whole weekend, and I just made everybody reassured them that every single chiropractor I had on my seminar probably has an entire page of testimonials and an entire website of testimonials. So whatever they're doing, they're already doing good,
Totally.
you know. But the one thing I would say about information is if you're coming at new information such as the polyvagal theory or such as what I teach or whatever, you've got to go back more than once because the first time you hear it, it's too new and that's just your brain opening up to a new concept.
Mhm.
And then you'll go and play with a little bit and hopefully your curiosity will last more than a week. And then you'll book on the next seminar and it's only on that second or third approach to something really new that you'll really actually get it. So, I hope people who do polyvagal or whatever they do, and there is something within chiropractic for everybody, and I think we all need to accept that, I remember the arguments between the upper cervical terrorists and the full spine terrorists and everything at Palmer.
Yeah.
There is something for everybody, and just because what you do is right doesn't make it right for everybody, and what I do is right doesn't make it right for everybody. And everybody in chiropractic has a testimonial on their website.
Well, and it's so funny because we were even saying like each time we do the same thing. So like I have like three different levels for my adjusting where you go upper spine, lower spine, extremities. And each time I do it, it's actually better because like we just said, we've been adding new stuff to it. So even when you come back to the same seminar, it's technically supposed to be the same seminar, but it's totally not the same seminar.
I've still got patient number 1, 5, and 7 from when I opened up,
Nice.
but I don't have patient number 2, 3, 4, 6, and probably somewhere between 7 and about 30. But anyway, the point is, I would love to go back to those people I started adjusting and say, listen, forgive me, I was an idiot. But I would also like to go back to the people who came to my first seminars and saying, I'm really sorry, I was an arrogant idiot, and but you've got to start somewhere.
Yeah.
And one of the things that I've learned recently is if you want to be good at anything, you've got to learn to fail faster.
Hmm.
Because if you're not prepared to fail, then you're never going to push the boat out anywhere. And I don't want to fail, but I know when I do fail, I know by doing and not doing necessarily as well as I would like, every time you do it, it's an evolution. And you said you're not doing your extremities one anymore in the way you're doing it. Are you evolving the whole seminar?
Yeah, I think as well, and again, I think we just over time, like we did a 2-day event in Australia that just went over, and just I think from the exact reason what you're saying that I think we're gonna going into next year, we're gonna try to do more like 2-day events because we almost need like the information to kind of come through and sleep overnight and then bring it back
Yeah.
because it seems like you said, like the first time you hear it, you're like, whoa.
Hmm.
And then if it's just a 1-day event, sometimes it's a little bit.
Yeah,
So
yeah.
I think again, it's part of evolving it. So we'll probably be blending like the lower spine with extremities because we're talking about fascia with protected shoulders and protected femur heads. Because I'm finding a lot of femur heads are all protected in all from the viscera and the pubic bone and the in the hip flexor,
Absolutely.
and it goes into the lower
Absolutely.
rib
I
cage and the
totally agree.
diaphragm. Yeah. So it all just
Totally
sticks
agree.
together, right? So anyway,
Totally agree.
we're going way over. So I just
Yeah,
already
yeah.
got we
Sorry.
got
Every time when we speak, we seem to. I like talking as well. I'm a Zimbabwean. We were born speaking, I think.
That's okay. Well, it's I think it's really cool information because I think it's if more chiropractors just got like just curious and excited and tried stuff, right? Like you said, if until you try stuff, you don't even know if it's going to work. There's no way you can pre-figure out if it's going to work before you try. So then you'll just never do anything. And so you got to try to do
Yeah.
something. And even if it's not the ideal thing, then you know not to do that next time, and you can try something different. So
Absolutely.
leaving everybody here with final words. What's your final words of wisdom to share with all listeners out there?
The reason Richard Branson is very rich is because he has provided a lot of service in his life, and he's found a way of providing service of a really high quality at a price people can afford, and he's made it repeatable. And all we need to do as chiropractors is go out and continuously provide service at a really high standard that's repeatable at a price people who are prepared to pay for value can afford. Don't worry about money. Just go out there and do a really, really, really good service, and you'll find it's repeatable, and people will pay you for that service because everything has a value and there's an exchange. So just go out and do the very best service you can, and everything else will follow.
That's wise words of wisdom from Dr. Donald Francis.
I hope so.
I appreciate it. For anybody who's out there in the UK, we will be doing our last lower body safety corridor seminar on November 16th in Windsor, just outside of London. So if we have a few spaces left for that. So if anybody's interested to come and visit us, who's over in Europe, we'd love to see you. And Donald, when's your next seminar?
I'm in Barcelona in October. I'm in Hamburg in November, and I'm actually rebranding to a new brand called Luminate. So we're also segueing back into the coaching world and teaching how to build a practice with my lovely colleague Laurie, who's helped me transform my we run a very, very successful practice in the middle of absolute nowhere. So if you can build a successful practice in the middle of nowhere, then you should be able to do it anywhere. So we've got one in Barcelona in October, 2nd, 3rd, and we're in Hamburg at the end of November.
Perfect.
Sorry, November 2nd, 3rd, I beg your pardon, and Hamburg at the end.
Okay, perfect.
Germany. Thank you,
All right.
Don.
Well, if anyone else is out there, go and see Dr. Donald too. Just
And I'll
always
see
sharpen
you.
this
I'm
up.
going to see you in Windsor. Okay, I'm coming.
Are you going to
You've
come?
talked me into it.
I've talked you into it. Anybody else want to come and hang out with me and Donald and then never know, we might even pull out a rubber glove in the bar. So awesome. Okay, thanks so much for being on the podcast. Appreciate it. I hope you guys are all doing awesome, and we'll see you again all in a couple weeks.